7:44. Welcome back to BT. June is Stroke Awareness Month. As I mentioned a moment ago, you're going to hear all these conversations, valid conversations, and information about the signs of a stroke. But we have two guests here this morning. They're going to help us understand treatment and what happens after a stroke. Please welcome to Breakfast Television, Dr. Winston, welcome, and Wilma, a stroke survivor. Dr. Winston, I'll start with you because over 400,000 Canadians are dealing with the after effects of a stroke. What are some of the conditions specifically that they're dealing with?
Sure. So most strokes usually happen on one side of the brain, which means that person will have deficits on the other side of the body, and that usually means either weakness or paralysis on that side of the body, lack of coordination, or something called spasticity, where the limbs are really tight and clawed and they can't use them. So even if they have a bit of movement, they actually can't open and facilitate that. Others can't speak because of language disorders, and a lot have pain and other conditions associated with that. 50,000
Canadians, or 50,000 strokes per year. Wilma, you are helping us put a face to those statistics. When did you first have your stroke, and what of those conditions are you dealing with yourself?
20 years ago, December 5th, 1999, I woke up from brain surgery and I was half paralyzed. I had no idea I was going to have a stroke. I have dealt with so much during 20 years. Just the worst thing is the sense of no balance, thinking you're going to fall all the time. A lot of things came back for me because I had lost my speech, I had lost my sight. The worst thing was my right side, which was completely paralyzed. You know, one day you have a perfectly functioning body. The next day, half of your body doesn't respond to your brain. So it's extreme stiffness.
And is the stiffness painful?
Yes, because it's so tight, the muscles can't release. And believe me, I was like this for a long time. I really was. And my foot, I would always go inside.
So, you know, it really does beg the conversation then. You suffered for a long time before you got the help.
20 years.
20 years. So, Dr. Winston, let's talk about your journey of healing with Wilma. When did you come into the picture, and how far has she come?
Sure. It's sort of a wonderful story. I'm based in Victoria, but I help my colleague, Dr. Rajiv Rebai, in New West once a month because we collaborate sort of on the Canadian and international level. And she had been having so much pain in her hand because it was stuck like this. She was sent for an occupational therapist who said, no, you need to see one of the rehab doctors, and saw Dr. Rebai Sr., but she couldn't walk because her foot was so pointed down that just putting contact to ground, it was a struggle just to stand up and walk across her kitchen. So Dr. Rebai prescribed a leg brace, but he knew unless we addressed the stiffness in the leg and arm that we wouldn't be able to help her. So I was the one that received her in New West and realized if we really forced out her arm, we could open it, and her foot. So we started doing botulinum toxin chemodenervation, which is injecting toxin into the limbs to loosen them up, and a combination of getting her a good brace for the leg, braces for the hand, and excessive physio, she actually is now walking all the time. She's
and painting as well, I understand.
Yes.
Can you tell us maybe what, for anyone who's never dealt with a family member or themselves dealing with treatment of stroke, what do you think that journey, what about it would you think would surprise people?
Just how lonely it is, the fact that you may actually have to be the one that physically transfers your loved one to and from a seating position, getting them dressed because they can't do up their dressing with only one limb that works, having to put on their braces, having to put on their all their arm accoutrement, the fact that they might not be able to speak clearly and get their thoughts across, the thought that they may actually have outbursts because they can't control it. So it's a lot of work for loved ones.
And what really hit home with me here, Wilma, is you said you suffered for 20 years.
Yes.
So is there still now a lack of access to services?
There is, and one of my goals, sort of, I'm on an international committee to get the people treated for those tone issues and weakness right away, right from the hospital. Where I live in Victoria, we do that very well because everybody knows everybody. So we get these urgent calls to treat people, and we can expand that around the country as well. But the biggest problem is if you're in a car accident, say ICBC, and you have a small car accident and hurt your neck, you can go for physiotherapy, acupuncture, massage, chiro, paid for by the people of BC.
You get put into a system.
Yeah, and your lawyer, or you can ask to have that for 5-10 years of coverage. If you have a stroke, once you go home, you'll maybe get in a queue and have 6 weeks of outpatient physio, and you're done for life.
Dr. Winston, thank you so much for sharing your insight and for helping all the people who are dealing with the after effects of stroke. And Wilma, for being such a vibrant figure on the BT couch this morning and sharing your personal story of survival.
Thank you so much.
BT continues. We've got